Thank you for choosing Carolina Asthma and Allergy Center for your allergy care. Since 1952, it's been our goal to help you manage your asthma and allergy symptoms. We appreciate you placing your continued trust in us, and we're committed to provide you with the best care possible.
Today, you are undergoing a comprehensive allergy skin test to help your doctor determine the specific things you're allergic to. Once we have the results of this test, we can develop a treatment plan to help you manage your allergy symptoms. The reason you're watching this video is because your doctor has determined that you are a good candidate for allergen immunotherapy. While not the only course of treatment for airborne allergies, immunotherapy has a very high success rate, and we hope you'll consider it. Once your allergy triggers are identified, we can help you to avoid exposure and lessen your reactions. Simple changes, such as following the pollen counts on our website and staying indoors when these counts are elevated, or avoiding lawn mowing, may help you. Dust mites, dogs, and cats are common indoor triggers for many people. If this is true for you, please ask us for educational materials to help you learn how to decrease your exposure. Right now, members of our staff are working on a plan for your therapy. We have already worked with your insurance company to provide you with information about your plan's coverage. We will provide you with this information and a cost estimate before you leave, so that you can make an informed decision about your course of treatment. Carolina Asthma and Allergy Center is pleased to offer our patients several treatment options for immunotherapy, including traditional allergy shots, accelerated schedule or cluster allergy shots, and sublingual drops or tablets. In this video, we will share specifics on both traditional allergy shots and accelerated schedule cluster allergy shots. Simply put, an allergic reaction is your immune system overreacting to a foreign substance entering your body. If pollen gets into the eyes or nose of someone without allergies, nothing happens. However, if someone has an allergy to tree pollen, for example, his or her immune response can cause classic symptoms like a stuffy nose, itchy eyes and throat, runny nose, sneezing, dry cough, and sinus headaches. Immunotherapy works to desensitize your immune system to harmless things like pollen, dust mites, or animal dander, and lessens or eliminates this reaction. Traditional allergy shots have been the preferred immunology treatment method for many years and have a very high level of effectiveness. This treatment path includes a 40-shot buildup phase or 2 shots per week for 20 weeks to reach your maintenance dose. Once you reach this stage, you and your physician will discuss your therapy and measure success of your allergy shots so far. Based on your doctor's assessment, and most importantly, how you're feeling, you can decide whether or not to continue. Remember, you're in control. When you have built to the highest dose, you will be converted to a maintenance dose. During your follow-up office visits with your allergist, he or she will evaluate how well you are doing with your shots and whether you can reduce or come off of your allergy medicines. If you're like 85% of patients that experience significant relief or elimination of symptoms and decide to continue treatment, the frequency of shots will decrease over time from once every 7 to 10 days, then every 14 to 17 days, and eventually taper off to once a month or every 28 to 31 days. There is some flexibility within the maintenance phase of your treatment, but keep in mind that you need to be consistent to receive the maximum benefit of the therapy. We know that life is busy and that some of our patients have circumstances which make it hard to commit to the schedule of 2 shots a week for 5 months. To help accommodate those patients, we are pleased to offer our accelerated program. Accelerated schedule cluster allergy shots can reduce the buildup phase by half compared to traditional allergy shots, allowing patients to reach maintenance in as few as 10 weeks. Not everyone is a candidate for this course of treatment. Patients must pre-medicate with 3 drugs, H1, H2, and leukotriene antagonists 2 hours prior to each scheduled appointment. Patients must not have a history of anxiety, heart disease, or asthma. Accelerated schedule or cluster allergy shots takes fewer number of visits, but longer time at each visit because it requires the patient to receive a cluster of 2 to 3 shots spread over 60 to 90 minutes twice a week during buildup phase. For your protection and to ensure treatment success, your individual serum vials are barcoded with your identification, and these are scanned at each visit. Vials are also color-coded, which indicates their strength as well as expiration dates. During the early stages of your immunotherapy, if you do not receive a shot for 8 or more days, your dose either will be repeated or reduced in strength. If you experience redness, swelling, or itching after receiving a shot, your dose may be decreased. A decrease in dose can cause a delay in building, but this is for your safety. It's important to tell your doctor about any and all medications you're taking before beginning immunotherapy treatment. One class of drugs, called beta blockers, can worsen systemic reactions to allergy shots and decrease the effectiveness of medicines used to treat these reactions, like adrenaline. For this reason, if you take a beta blocker, you should not start an allergy shot regimen before having an in-depth discussion with your allergist. Some common examples of beta blockers are Toprol, Inderal, Lopressor, Tenormin, Corgard, Viscan, Blocadrol, Sectrol, and Xiac. We will provide you a more complete list of commonly prescribed beta blocker drugs to read carefully before you begin immunotherapy. This video covers a lot of information in a short amount of time, and we know it's a lot to take in. But don't worry, you'll be getting a shot packet with the information contained in this video and more. Keep it handy. It will be a valuable resource for you during your treatment. Of course, if you have any questions about anything related to your treatment, don't hesitate to call us. Please be prepared to wait the 30 minutes in our office after getting your shot. And remember, if you have any of these symptoms, tell one of our staff immediately. Be sure to report any other minor delayed reactions to your nurse before your next injection. Remember, the faster the reaction is treated, the less severe it will be. Most important to remember are these rare but serious systemic reactions: itchiness and hives, swelling of the tongue or throat, wheezing or shortness of breath, abdominal pain for no reason, or lightheadedness. If you experience any of these, especially breathing problems, call 911 or go to the nearest emergency room. We hope you'll decide to give allergy shots a try. Immunotherapy is very effective. The 5-year success rate is about 85%. Before you leave, your caregiver will share a customized therapy plan designed just for you, along with a fee schedule, and will answer any questions you may have. You'll receive a shot packet full of valuable information, including what we've shared with you today, along with a consent form for you to fill out and return if you decide to continue with treatment. Be sure to check out our website, www.carolinaasthma.com, for valuable allergy and asthma information, including our daily pollen count. Thank you once again for choosing Carolina Asthma and Allergy Center for your allergy care. For more than 68 years, we've been delivering patient-focused care to all ages and are committed to education and improving quality of life so you can breathe, live, and thrive.